At Mayo Clinic, we try and get a sense of what the patient needs before they actually get here. The benefit of coming to Mayo Clinic as a center of excellence, a center of experts, really allows us to consolidate their care, having an efficient treatment course, a short itinerary, where we can really get them back home to their family and back to normal life after their treatment.
Any cancer diagnosis is really a life-changing diagnosis, but colon cancer comes with a number of different unique challenges.
A lot of our patients come with the concern, and it's a very legitimate fear, of having a permanent colostomy bag. Some of the significant progress we have made in the last decade is having the opportunity to provide treatment that delivers a cure while also avoiding the need for surgery that results in a permanent colostomy.
A patient is not defined by their cancer. A patient is defined by far more than that. And again, if we focus on just the cancer, we might do well for that cancer, but we might leave the patient with long-term side effects that otherwise they wouldn't have to have. And so it's very important for us, with all of the available tools that we have, to understand when we use them and when we don't.
There have been numerous surgical advancements in colorectal cancer care, and Mayo Clinic has been at the forefront of these for decades. Years ago, we were innovators with laparoscopy, a minimally invasive technique for colon cancer, and we led those clinical trials across the United States. More recently, with the expansion of robotic surgery, Mayo has gone further in terms of developing these techniques and helping to develop the technology. And all of these things put together have allowed Mayo Clinic to be at the forefront of colorectal cancer surgery care.
We've known for more than 150 years that the immune system plays a role in cancer. But really the issue has been we haven't been able to harness it enough. About 10 years ago, we started doing clinical trials with specific immune-targeted therapies, and we started seeing a hint that we might be onto something. Tumors that otherwise previously wouldn't have responded at all, that were really refractory, patients that, otherwise would have months to live, were now cured. We couldn't find cancer anywhere. But our goal, continuing to sort of push for cures, is that how can we find a way to help patients that no one else can?
Cancer care in general is so integrated, and so you really do need to be treated and cared for at a place that has an integrated program where you have specialists who focus on the specific disease you're being treated for.
I think a second opinion is really invaluable. And at Mayo Clinic, our experience has been that patients who are told that their tumor is not resectable or inoperable elsewhere, that it truly is resectable more than 50% of the time.
So my goal for every time I see a patient is to obviously cure their cancer, but get them to a point in the future where this is sort of a distant memory, that they look back and say, boy, that was a tough time, but I'm glad I'm through it and it's nothing I have to worry about anymore.